Good morning, doctors. Welcome again. Today we are going to discuss about Cauda equina syndrome. What is this? This is a set of intradural nerves provides sensory and motor innervation from L2 and S5, the end of spinal cord from L2, L3, L4, L5, S1, S2, S3, S4, S5. This is known as Cauda equina syndrome. It's not a diagnosis; it's a symptom. It's a group of symptom. Okay, and innervation to hip muscles, lower extremities, urinary anal sphincter, genitalia, and sexual function. These nerves innervates. Okay, these things like most common cause of Cauda equina syndrome is disc herniation, L4, L5 lumbar stenosis. The lumbar stenosis causes is due to osteoarthritis, trauma, neoplasm, or any kind of metastasis, infections, or abscess may cause lumbar stenosis. Now, the lesion compressing nerves it cause weakness, pain, and sensory loss. History of we see such kind in old because in old person intravertebral disc degeneration occurs or a patient with trauma or a cancer patient we found such cauda equina syndrome. Now symptoms: lower back pain, patient complains of lower back pain, lower extremity deficit, loss of sphincter tones which causes incontinence, and ED it's erectile dysfunction. It is due to L2, L3 and L4. Absent deep tendon reflexes, L1 and L2 for cremasteric reflex. This is absent in cauda equina syndrome. S2 and S4 is responsible for bulbocavernous reflex absent. When you squeeze a penis, then the anal muscles contract. This is known as bulbocavernous reflex. This is absent. If you put catheter in urinary catheter in a patient, then anal sphincter muscles are contract. So this contraction is absent due to bulbocavernous reflex absent. Okay. How to diagnose? Diagnosis of lumbar spinal MRI, or we can say lumbosacral MRI, is the most accurate here. If the cause is infectious, then need to do CSF analysis or culture, that is most accurate. Or if you want to rule out the lung cancer metastasis, then you have to go through the chest x-ray. And how to treat this syndrome cauda equina? Always treat the cause. If the cause is rheumatological, then refer to rheumatologist, neurological, neurologist, and orthopedician, then orthopedician. Treat the cause, refer to the specialist in such kind of case. Lumbar and sacral roots. Let's discuss some L2 rest supplies for upper thigh and knee medially, and L3 is for lower thigh, knee laterally, and L4 is for mid leg, knee posteriorly, and L3 and L4 responsible for patellar reflex, L2, L3 and L4 reflex for sexual function, and L5 is for dorsum of foot, and S1 and S2 for lateral foot, S3 and S5 for saddle or sphincter genitalia responsible. If there is a stenosis or disc herniation in L2, L3 and L4, then sexually patient is not able to, he is suffering from ED, erectile dysfunction. So guys, I hope till here it's very much clear for you. If patient with incontinence, it is mainly due to S3 and S5 lesion. So guys, have a good day. Goodbye. I hope about this Cauda equina syndrome, it's very much clear for you. If you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and goodbye. That's all for today.